Hello, my Form 4s. Hello to everyone. Welcome back to our Biology Weekly class for June, week 3. Alright, last week we have finished our digestive system, if you still remember. Okay, we finished everything. And today we are talking more about diet. Okay, more of a K-part stuff, more of a eating disorder stuff. Alright, still important because this will be asked in your essay. Okay, a lot of out of syllabus stuff would be asked here. Alright, so let's begin. Okay, so diet modification for specific individual. Alright, so what do you mean by specific individuals? Okay, so if unless you have diseases or whatever, you are considered a normal individual. So we eat normally. Okay, most of us do. Okay, we eat normally. Although Malaysia, what is defined as normal, Malaysians mainly we don't eat very healthy. I hate to say it. Okay, we eat a lot of high fat, okay, high sugary food. Okay, we love it. Okay, it's our Malaysian food. Okay, so a balanced diet for each individual will vary according to lifestyle, health conditions, specific nutritional requirements. All right, so it depends on the lifestyle. This is more of a choice thing. Okay, it depends on what you eat, and then of course health condition, you have no choice. If let's say you have certain food you can't eat, okay, you have to avoid. And then specific nutrition requirement, let's say if you're pregnant, if you're infant, okay, if you're a child, okay, whatever, okay, or especially you adolescent, okay, you need specific nutrients. All right, so among the objectives of diet modification, why do we change some people's diet? Okay, why do we modify them? Number one, to correct any deficiencies in diet. Okay, so some people lack something or they need certain things more than others. And then maintain, preserve good diet status. Okay, exclude any food substance that may be harmful to patient. This is especially important. Okay, let's say you're allergic to some food or your a certain health condition doesn't allow it. Okay, and then to adjust the diet accordingly to the abilities patient's body to metabolize nutrients. Let's say you are unable to digest something or absorb something, then we have to eliminate that something from your diet. Okay, and then to give a rest to a certain part of the body that has been infected by disease or after a surgery. Okay, so this is mainly to deal with people who are recovering from a disease. Okay, and then diet modification can be implemented based on the Pinggan Sehat Malaysia or Pyramid Makanan Malaysia by taking into account the objectives of diet modification. Alright, so every one of us know the food pyramid, but how many of us really follow that thing? That is a very good question. Okay, that's why obesity in Malaysia is so common. In fact, it's so common in many developing countries. Okay, Malaysia is considered as one of the most obese country in the world. Okay, so what's wrong here? Okay, so let's look at what health problem you have and what should you and should not eat. Okay, let's say obesity. Okay, this is the first thing we have to talk about because it's such a serious problem. Why do we care about obesity so much? Okay, number one is because of how you look. Okay, when you're obese, you don't look good. Obviously, you don't feel good. You don't feel confident about yourself. Okay, people tend to look down on obese people. Okay, why? Because it's not healthy. Okay, so maybe you have some underlying medical conditions, and then we are not going to talk about that. Okay, but mainly obesity is by choice. You have a choice. You can make a difference. All right. So what should you eat? Okay, fruit, vegetables, bread, brown rice, low-fat milk, fish, nuts, oats. Mainly, what we call it low-calorie food. Okay, low calories, okay, calorie food. Okay, you should not eat anything that has high energy. Okay, this goes for healthy food. Okay, what I mean is, yes, chicken breast is healthy. Yes, nuts are healthy. Healthy food, if you eat it a lot, you still get fat. Okay, so that's the point. Nuts, if nuts is healthy, it doesn't mean you can eat a lot if you're obese. Okay, you should cut out on the nuts. Okay, so what should you not eat? Fast food rich in fats, obviously. Soft drinks, obviously, unless it's a 0-calorie thing, then it's fine. Okay, sweet and oily food, obviously, because it's high in sugar and fats. Alcoholic drink, it's also sugar. Okay, alcohol is sugar, it's made from sugar. High carbohydrate food, sugar again. Mainly sugar and fats. Okay, please avoid them. Okay, you think you need them, but you don't. okay? It's just your body tricking you, okay? Because you're so used to these types of junk food, you think you need it. Actually, you don't. Okay, it's more of a want thing. You want it. Okay, so obesity is a choice most of the case. 99% of the case is a choice. All right. So, and then number two, cardiovascular disease. Okay. One of the reasons why do we care so much about obesity, because obesity increases the risk of cardiovascular disease, okay, or we call it CV disease, cardiovascular. Okay, so cardiovascular disease, this is a chronic thing. Okay, it's years and years of bad dieting that causes cardiovascular disease. Okay, so what should you eat more? Tuna, sardine, salmon. Can you see lean meat? Okay, same thing here. You need low-fat food. Okay, low fat, especially saturated. Okay, because it's the saturated fat that makes you have CV disease, not cholesterol. Okay, it's fine to eat eggs, but it's not fine to eat saturated fat. The real enemy is saturated fat. Okay, so don't kick your cholesterol away. Those are good cholesterol. And then corn oil, olive oil, sunflower oil. I can see these are unsaturated fats, okay, or oil if you want to call it. Okay, fruits and vegetable. Okay, especially very important here, fiber. Fiber not only helps in your constipation, it also helps absorb your cholesterol. Okay, it helps to clean your blood vessels so that you don't get deposits on them, which can cause heart disease or CV disease. All right, so fiber is more important than you think. It's not only for you shitting well, it's also for cleaning your blood vessels. Okay, so eat your fiber, kids. Okay, so reducing cholesterol. Grains contain dissolved fiber, helps absorb, okay, LDL. Okay, LDL is a bad cholesterol. Okay, so we need to decrease our LDL, and we need to increase our HDL, high density lipoprotein, which is the good guy cholesterol, which the eggs contain. So don't throw away your yolks. Okay, throw away your KFC. That is more practical. Okay, so people yap about cholesterol in eggs, yet they eat KFC and McDonald's, which I don't understand at all. It makes no sense. Okay, all right, so consume white meat. Okay, please don't eat red meat. Okay, because red meat, as again, it contains a lot of saturated fat. Okay, especially like steak, okay, beef, pork, mutton. Okay, they are full of fats. Okay, animal fats especially. So what should you avoid? Okay, it's the opposite lah. Okay, if you just have to memorize one side, the other way is the opposite. And if you ask me, this is more common sense. Oily and fatty food, animal fats such as margarines, cheese, okay, they are saturated fat. Food rich in sugar, red meat, rich in salt, sodium, okay, because salt can increase your blood pressure. Okay, so salt causes HBP, okay, high blood pressure. All right, and then diabetes. Obviously, diabetes is because you can't produce insulin. Okay, we'll talk about it later. So what do? You eat fruits, okay, but not fruit juice. Okay, vegetable, cereal, low fat, protein, almond, walnut, okay, common sense stuff, complex carb. Okay, what is complex carb? Complex carbs are carbs that are not easy to digest. Okay, like brown rice, wholemeal, chapati, legumes. Okay, these are very hard for your body to digest compared to white bread. White bread enters your body and boom, it will be digested in a very short while and you will absorb all the sugar. These are not easily absorbed. Okay, it will not spike your blood sugar. That's what they call it. Okay, so it's good for you. So what should you not eat is the other way. Okay, food rich in sugar, high cholesterol food, fruit juice. Okay, I told you, fruit juice, sweet fruits, banana, alcoholic drinks, from. Okay, normally for diabetes patient, it is not recommended for you to eat fruits. Okay, vegetable is fine. All right, and then next, cancer. Okay, cancer is not a disease; it's a class of disease. Okay, a liver cancer is not the same as lung cancer. Okay, yeah, okay, essentially they are the same. Okay, but there are differences. All right, so how can you fight cancer? It's not that something a diet can fix. Diet is only a small sub-factor of it. Okay, so this part is not really important. Okay, mostly common sense stuff. Food high in energy and protein to supply daily energy, replace injured and damaged tissue, strengthen body defense, blah blah blah. Drink a lot of water. Okay, green vegetable, herbs and spice, cultured dairy products, blah blah blah. Okay, mainly you need something called antioxidants. Okay, these are the ones that protect you from cancer. So eat your antioxidants. So what are they? Vitamin A, C, E. Okay, so they will. What is antioxidant? Means if there are bad stuff in your body that wants to attack your body cell, so these things will protect you from the damage. Instead, the bad stuff will go and damage them instead of your body cell. So they are like a suicide warrior. Okay, So this is how they work actually. All right. So what should you avoid? Okay, how should you prevent cancer? Coloring, preserved food, flavored food, sweet food, red meat, alcoholic drink, fermented food. Okay, I wouldn't be so concerned about these. Okay, do you know what increases risk of cancer? Again, obesity. Okay, so that is why they concern so much about obesity. When you are obese, your risk of cancer increased by a further 50%. Yes, 50, not 15, 50, 50. So don't be obese. That's the first step. That's why they say obesity is the gateway to all diseases. When you are obese, your risk of other diseases increase dramatically. So the first step is don't be obese. All right, I'm not saying that you won't get cancer if you're not obese, but you greatly reduce the chance. All right, I hope you get my message here. All right, and then so health issues. Let's look at health issues related to diet. Okay, adaptation of digestive organs. So how should you overcome obesity? You can overcome through self-discipline, such as following a low-fat and carb diet. Okay, regular physical exercise. If I can do it, then you can do it. Okay, I'm not so different from you. I'm a human being as well. Okay, I exercise 5 times per week. I eat a very low-fat and carb diet. Okay, because I take care about myself. Okay, I care about having a good quality. I want to live till I'm 70, 80. Okay, with good health, not by having diabetes and dragging until I'm 70. Okay, I don't want to live that life. Okay, I don't think you would want it too. Okay, common sense. All right, so self-discipline. It's good to have it. Okay, you need discipline in everything, in studying, in doing a job, whatever. You need discipline in everything. Okay, and then at times obesity requires medical treatment such as gastric bypass surgery. Okay, in short we call it GBP. Okay, GBS. Okay, some they call it G. So what is this? Basically this is tying up. Okay, basically I make one more. Can you see there's one more way here? Straight away go to your jejunum and your duodenum. Okay, means some food they won't enter your stomach. They will bypass straight away and go to your small intestine. So less food is being digested, less food is being absorbed. Okay, so sleeve or you use sleeve gastrectomy. What is sleeve gastrectomy? Means a part of your stomach is tied up. Okay, to reduce the space in your stomach. Okay, it stops you from eating very effectively. Why? Okay, when you eat, your stomach gets filled up. When your stomach is full, it will send a message to tell your brain you are full and you're happy. Okay, so this is some sort like a trick to reduce the space in your stomach so that it's easily filled and your brain can get the message very quickly. Okay, adjustable gastric band reduction of the stomach size to reduce weight. Before you say, oh my god, this is the best thing ever, I'm gonna do it, please be mindful that there are complications related to this. Okay, anything artificially done to your body can't be good to you. Okay, why not just practice some self-discipline? It's free. This thing you would waste thousands on it, and what if you got some complications? Okay, you might not have gastric problem, and after doing this, oh my god, you have the worst gastric problem ever. Why risk? Okay, just practice self-discipline. Put down the fork and stop eating. That is free. You actually save money for not eating that much food. Okay, and then next, individual who has undergone gastric bypass surgery will experience very rapid onset of stomach feeling full due to reduction in stomach size. Okay, obviously because the stomach is reduced in maybe 30%, 40%, you eat less food. Okay, less food means less calories, means you lose weight. Okay, so for me this is like a band-aid over gunshot wound thing. Okay, it doesn't fix your binge problem. If you have a binging habit, you need to tackle the problem itself, not this. Okay, not any diet pills or whatever. You need to control your eating. Okay, simply said. All right, so positive effect, improve in confidence. Okay, we are so obsessed with that. Oh, this is how you should look. Okay, we are so brainwashed nowadays by all these advertisements and whatever. Okay, reduction in blood glucose, better control of blood pressure. Okay, this is some sort of like the last resort thing. If you can't stop eating, if you are morbidly obese, if you don't stop eating, you're gonna die. Okay, the doctors are gonna do this to you. Okay, so what are the negative effects? Okay, risk of infection, absorption of nutrient reduced. Okay, patient may vomit if he overeats. Okay, you will feel painful if you overeat. So short-term effect, see, you will get all these gastric problems, acid reflux, nausea, vomiting, enlarged esophagus. Okay, and blah 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 blah. All these complications. Long-term effect, low blood sugar, malnutrition, stomach ulcer, problem with defecation. Okay, you might get, you might not have constipation before this, and after doing this, you might get the worst constipation ever because you're doing something to your digestive tract. What do you expect? Okay, so like I said, the best way is to restrict your calories. Okay, that's the smart way of doing it. All right, so defecation, I already talked about this last week. Okay, constipation. What is constipation? Difficulty in removing hard feces or stool because the stool is too dry, you don't get enough fiber. All right, so excessive absorption of water. Okay, why? Because you don't get fiber. So intake of food rich in fiber that makes defecation easier. Okay, so what does it do? It stimulates peristalsis. It prevents health problems such as constipation, absorb and eliminates toxic substance. Like I said, if you eat a lot of toxic substance, fiber actually help flush this out. Fiber and water. You don't need all these detox tea. Fiber is a detox guy. Okay, regulates absorption of glucose. Okay, you don't absorb that much sugar if you eat fiber. Okay, increase population of good bacteria. Okay, when you eat fiber, you are making your stomach full without the calories. That's why eating salad makes you lose weight. Okay, because a whole big bag of baby spinach causes 50 calories. Okay, but a spoonful of peanut butter costs you 150 or 100. Okay, so which would you rather eat? Does the spoonful of peanut butter make you full? No, but I bet you can't finish that bag of baby spinach because it's so filling. Okay, so eat smart. Choose some low calorie food. You might not even need to starve yourself. Okay, you just eat some food that has very high volume, such as popcorn. Okay, a bowl of rice is 200 calories. A big bowl of popcorn, unsweetened of course, without butter of course, is also 200 calories. Okay, a bowl of rice easily you can finish, but that bowl of popcorn might take some effort to eat because it's so big, it's so filling. Okay, so that's what I do. Okay, and then next, what's hemorrhoid? Okay, if you get constipation for a while, you might get hemorrhoid. Okay, what is this? Okay, imagine this is your butthole, this is your anus. So if you have hard feces coming out every day, you will hurt this wall around it. Okay, and these walls around it, they have blood vessel. You might make the blood vessel swell, inflame. So when inflammation happens, the blood vessel might get protruded out from the asshole. Okay, from a butthole. So that is what we call hemorrhoid. Okay, if you get blood in your stools all the time and you feel your butthole hurts, that is hemorrhoid. Okay, so the swollen vein located in the walls of lower rectum and anus causes a person to feel pain at affected areas. So how should you tackle this hemorrhoid? Eat fiber. That's why fiber is so important. Okay, I can't stress this enough. So diarrhea, watery feces. Okay, this is the opposite of constipation. So chronic diarrhea causes loss of body fluid. That's why if you have diarrhea, you should drink more water. You can be dehydrated and die. Okay, so what causes diarrhea? Diarrhea is actually a symptom. It's mostly caused by gastroenteritis. Okay, what is gastroenteritis? Basically, it's a swelling of a digestive tract, either by eating the wrong food, eating too spicy, or you have some bad bacteria inside going on. Okay, you'll be fine. Okay, you'll be fine. Your body will fight it. Okay, you just need to replenish the fluid. Your body will do its job in fighting the virus or whatever. Okay, or bug or whatever. Okay, next, colon cancer. So if you're constipated for over 20 years, 10 years, you might develop this. Okay, it's when your large intestine starts to develop tumor because there are so much toxins inside. So what do you do with these toxins? What do? You eat more fiber and you flush it out and you drink more water. Okay, fiber and water is very cheap, but treating colon cancer is very expensive. Okay, so being the smart guys and girls you are, what would you do? Of course, you would choose fiber and water. Is less painful as well. Okay, so prevention is better than cure. This saying couldn't be much truer. All right. Next, health issues related to eating habit. Okay, these are mostly psychological stuff. So taking meals at appropriate times. So these are good habit. Avoid overeating. Okay, stop binging. Okay, eating a balanced diet, eating sufficient amount of fiber. Okay, drinking at least 2 to 3 liters of water. So does it mean I don't eat fast food? I don't know. No, I eat fast food. I love fast food. I love pizza. Okay, but I enjoy moderately. Maybe once in a month or whatever. Okay, eating it every day. Do you enjoy it? No. Okay, it's just you giving in to all these shitty food. Okay, you need to reconsider your diet. Okay, next, gastritis. Okay, this is what we actually call gastric. Okay, there's no gastric. Gastric is not a disease. Gastric is an adjective. Okay, so the disease name is called gastritis because itis is swelling, means the swelling of your gastric, which means your stomach. All right, so it's the inflammation, like I said, swelling. of the epithelial lining of the stomach, which develops into a hole, okay, gastric ulcer. Okay, this is the late stage already. So gastric juice as secreted in the lumen will erode the epithelial lining. Okay, this happens to us all the time. The acid will eat away your stomach lining every day, but you don't feel anything because you replenish the epithelial cell every day. So why would you have gastric? Okay, it's maybe because of a genetic thing, or you really did starve yourself, or you just have a bad eating schedule. Okay, so lining of the stomach, if food is not taken when you feel hungry, if left untreated, gastritis can lead to gastric ulcer, increase the risk of stomach cancer. Okay, I wish to tell you that stomach cancer is unlike any other cancer. The mortality rate is very high. Okay, this is what is told by doctors, not by me. Gastric cancer or stomach cancer is very hard to cure. Okay, so the best way is not to get it. So what is causing you to have gastritis? Number one, taking meals at irregular time, different quantities. You eat a lot and then you eat very little. You eat a lot and you eat very little. Your stomach will be like, bro, what the hell, man? Okay, and then number two, excessive alcohol. Okay, alcohol can actually erode your stomach, especially if you drink it in empty stomach. Okay, excessive consumption of painkillers. Okay, like I said, painkillers like Panadol. Panadol contains paracetamol or acetaminophen. Acetaminophen is the scientific name. So acetaminophen is acidic. So if you eat it in empty stomach, you will burn a hole in your stomach. Okay, I do it sometimes. Okay, not proud of it, but I'm fine because I don't have gastric problems. If you have, then you need to be careful. That's why painkillers, they are stated there. It's stated there, eat after meal. Okay, because you don't want the stomach to be full of this acid. Next, not eating for long hours. Okay, you starve yourself, and then this is a very special case. Presence of Helicobacter pylori. This is a type of bacteria that hides in your stomach that is not afraid of a stomach acid. Okay, this will slowly develop into stomach cancer. If you have pylori bacteria, very easily you can go and do a blood test. You will know you have pylori bacteria because you have the antibody inside your blood. So if you have pylori, you need to take a type of medicine to control this thing, and you cannot share cutleries with anyone. You need to have your own cutleries. Okay, that's why pylori bacteria is so common among Chinese, because we don't use the, that when you have a dish, you will have a spatula there to, put it into your plate. We don't use that. Okay, Chinese seldom use that. We just use our own chopstick that we have already put in our mouth, and we just take the dish we like. So if I have pylori will come to my mouth, and then it will jump onto my chopstick, and then if I put it into my food, okay, the food that everybody shares, that food would have pylori bacteria and everyone would get it. Okay, that's why if you have pylori, don't share cutleries. Okay, not many of us know, okay, but it's good to know. Alright, so can be treated with alkaline and antacid medication. Okay, this antacid is mostly like a band-aid thing. It's like a temporary solution. You need to find out the root cause of your gastric. Simple. Alright, bulimia nervosa. This is a psychological disorder. It's nothing to do with your body. It's more like a in your mind thing. Okay, I wish to talk together with this anorexia nervosa. Okay, both are eating disorder, mainly experienced by girls. Okay, both cases, they think that they are becoming fat. Okay, we are so obsessed with the slim body type. Okay, we starve ourselves in order to get there. So bulimia is excessive food taking and vomiting. You eat, you feel guilty, you scratch your throat and you puke it out, or you eat laxative, you shit it out. Okay, victim consume large amount of food. Okay, you binge. So victim will feel guilty, ashamed, depressed. Okay, they take self-induced, okay, or laxative to induce diarrhea. Okay, so this is why you don't starve yourself doing any kind of stupid diet. Okay, when you do any kind of stupid diet, you will starve yourself, and then you will start looking thin. And then when this thing rebounds, okay, you cannot, your self-discipline fall apart, and then you can't take it anymore. You will start eating, okay, you can't stop yourself, and before you know it, you feel ashamed, you feel guilty. Okay, that's when you develop this bulimia nervosa. Okay, and then anorexia nervosa is almost the same thing, but in this case, the patient doesn't eat. Just now it's eat and puke. Now this is doesn't eat. So the person experiences intense fear of gaining weight, avoid eating intentionally. Okay, 15% or more below normal body weight. Okay, mostly in female teenagers. Okay, because they're so obsessed with this thing. Okay, all these Instagram and Facebook are brainwashing us. Okay, it's making you less happy with yourself. You think that, oh my god, I'm so fat, whereas you're like 50 kg, you are fine. 50, 60, you are fine. Okay, you are healthy. You don't need to look like that. Okay, models don't look like that. They only look like that because of Photoshop and whatever. Okay, so don't stress yourself into thinking that you have to look like that. No. Okay, so very thin, fear of gaining weight, they lose their appetite. Okay, so you can actually die from anorexia nervosa. Okay, mostly due to heart failure. So don't do that. If you have anorexia or bulimia, you need counseling. Okay, you need some psychological counseling. Okay, because it's a psychological disease. Nothing is wrong with your body. It's just in your mind. Okay, so muscle dysmorphia, this is more of a guy thing. Okay, because we want to be more muscular. So you look at the mirror, you think, I'm not muscular enough. So I need to be more muscular. Okay, so feels they are small in size and not muscular enough among male. Okay, muscular body, so they will do weightlifting, intense training, exercising. Okay, I don't think this is as bad. Okay, this actually forces you to go exercise. Okay, which we lack a lot. Okay, for when's the last time you exercised? Okay, maybe you're a teenager, then you're fine. When's the last time your parents went and exercised? Okay, if your parents are living a very sedentary lifestyle, they need to exercise more. Okay, 3 times per week is the bare minimum. Are you hitting the minimum? If not, then you need to. Alright, so this is not as bad if you ask me. Okay, what is pica? This is not so famous. Okay, this is psychological, again, a psychological disorder. Or you call it compulsive eating disorder, but this is a more serious version. You go and eat non-food item, okay, like stone, chalk, chair, soil, and glass. Yes, I've actually seen this, okay, on TV. Okay, they start eating couch, they start eating sponge. Okay, so this is again a psychological disorder. They have a deep underlying disorder that makes them eat something else. Okay, maybe they have abusive past. Okay, they have a very abusive parents or whatever. Okay, so they need to tackle the root cause. This is just a symptom. Pica is just a symptom. All right. Next, type 2 diabetes, okay, which is diabetes mellitus. Okay, diabetes mellitus has 2 types. Number 1 is when you fail to produce insulin. This is mainly you're born with it. Number 2 is when your body still produces insulin, but your body fails to react to the insulin. Mainly is due to you eating too much sugar. Your body just gives up. Okay, mainly it's self-induced. All right, so you have insulin. Can you see? You have insulin, but your body doesn't react to the insulin. Okay, so health condition where blood glucose is higher than normal due to inability to secrete insulin. Okay, this is mainly type 1 lah. Okay, and the excess glucose cannot be absorbed by cell, tissue, organ that require glucose to produce energy. So what do you cause this? Okay, you take too much sugar. When you eat too much sugar, your sensitivity to insulin actually decreases. Okay, your body actually doesn't react that well to sugar because your body will be like, you know what, you're not going to stop eating. What's the point of me producing that much insulin? Okay, and then take your food rich in simple sugar. So type 2 diabetes is mainly caused by yourself. Okay, so acid reflux, this is a very common thing, mostly in the gas. This is one of the symptoms of gastritis. Okay, so what is acid reflux? When you have this gastric juice, okay, all this acid going back into your esophagus, okay, going into your esophagus and up here. So you'll experience something called heartburn. Okay, so why? Because this acid burns, so when it's near your heart, you feel the heartburn. Okay, a lot of people actually mistaken this for cardiovascular disease. Oh, they think they're going to have a heart attack, and then they go and take an endoscope and say, oh, actually I have acid reflux. All right, so what happens? The esophagus sphincter, okay, this valve over here, okay, it weakens and does not contract. So in normal conditions, sphincter relax and enable bolus to enter stomach. Okay, so it contracts to prevent bolus from returning to esophagus. But in the case of the patient, okay, so it fails, so the gastric juice enters the esophagus. Okay, what causes this? Okay, mainly is gastritis. Okay, or you just eat too much, you will have acid reflux. Okay, so you have something, I'm not sure you have seen the commercial, okay, the Gaviscon. Okay, you have, what is Gaviscon? It's actually it's like a milky stuff. When you swallow it, it will form a layer of hard substance, okay, on your stomach, okay, on the acid. So your acid will not be refluxed back into your esophagus. Okay, so if you have acid reflux all the time, mostly it's because you have gastritis problem. All right, obesity, we have talked about this. Excessively overweight, okay, we have Thor over here, okay, in Endgame, okay, it looks like this. Okay, and then due to accumulation of fats, so BMI exceeds 27.4. Okay, I don't like using BMI. BMI is not accurate. Okay, for normal individuals, yes. Okay, but for people who love exercising like me, BMI is not accurate. Okay, for you, BMI 25 might be okay, healthy, but for me, okay, for a lot of athletes, 25 is actually considered as fat. Okay, you are okay, but you are not great either. Okay, so I don't like BMI. I like to look at body fats. Okay, if you have a protruding gut, if you have a very big stomach, you are fat. Okay, you might say, oh, my BMI is normal. No, you're not. You're fat. Okay, you need to stop eating. Okay, so caused by intake of excessive processed food and food high in energy, for example, fast food. Okay, intake of excessive sweet drinks and sweet food, obese person prone to various kind of disease. Like I said, if you are obese, you increase your risk of all types of diseases. Okay, that's why we don't like our partner to be obese. It's not that we are, you know, such a visual animal. We only like beautiful things. Anyway, who isn't? But it's because we don't want our partner to die early, and we have no one to take care of our offspring. So this is a survival thing. If someone doesn't like you because you're obese, you can't blame them. They want a healthy partner. Is that wrong? No. Let's say a peacock would want a very beautiful peahen because the peacock wants the offspring to be beautiful, to have good genes. Can you blame the peacock for being, oh, he's such what, so visual? Okay, so every body matters. Okay, cut that bullshit, guy. I hate that thing. Okay, you should not be obese unless you have an underlying medical condition. Then that's a different story. You should not be obese. It's not healthy. It's not sexy. Stop making obesity sexy. No, it's not. Okay, the dad bod thing. No, it's not sexy. Okay. Alright, so that's it for this chapter. Okay, sorry for the ranting. Okay, I need to educate you straight because that's what the society thinks nowadays. Alright, so let's look at the exercise. Okay, we have done this. So let's look at question 14. Should we look at the essay question? No, let's skip this. Okay, if we have time later, maybe we will. Okay, so oh, eating habit. Okay, we have another essay question, so no choice, we have to do this. Okay, like I said, this last part is mostly asked in the essay question. Okay, so diagram shows several eating habits of humans. So we have self-induced vomiting. This is your bulimia nervosa. Okay, and then excessive intake of high fats diet. Okay, this might cause obesity. Okay, or cardiovascular disease. Afraid to eat any food. This is anorexia nervosa. Food not taken at regular time, you might get, okay, gastritis. Okay, obsessed with having muscular body. Okay, this is what we call muscle dysmorphia. Dysmorphia, this is how I spell it. Okay, state the disease and explain how the eating habits affect human health. Okay, so what is, oh, basically you state all the disease, you get all 5 marks. Oh, that is so simple. So I already get 5 marks here. Okay, 5 marks. Okay, so how does it affect human health? So for A, how does it affect human health? You might cause, okay, what will bulimia nervosa cause? You can actually cause esophageal cancer. Okay, esophageal cancer. Okay, it's a thing, your esophagus cancer. Okay, if you vomit all the time. Okay, obesity, you can cause a lot of things. Okay, cancer. What else? Cardiovascular disease. What else? Stroke. So many. How about C? Anorexia. Okay, you can cause heart failure. Okay, you can say excessive weight loss. Okay, this is the direct effect. Gastritis, you can cause gastric cancer. Okay, how about E? Muscle dysmorphia. Okay, how does it affect human health? Okay, you do excessive exercise. Okay, or weightlifting. Okay, simple, 10 marks, alright, over here. Okay, so diagram 9.1 and 9.2 shows caused by malnutrition. As a dietitian and need to give health talk, discuss the effect of malnutrition and suggest ways to overcome the problem. Okay, so 5 for each. Okay, so this is obesity, you'll get 1 mark. Okay, so what is the effect and way? So let's say 2 effect. Okay, it might cause low self-esteem, I accept. Okay, low self-esteem. Okay, cardiovascular disease. So what should you do? Okay, reduce intake of high calorie food. Okay, replace with healthier food options. Okay, for example, fruits, veggies, whole food basically. Okay, less processed food and more whole food. So diagram 9.2, this is anorexia nervosa. Okay, so what is the effect? Okay, so excessive weight loss. Okay, what else can it cause? What else can anorexia cause? Okay, so let's see what are the points here. Basically same emotional problems, yeah, you can get it. Oh yeah, even menstrual cycle, yes. Okay, you can affect your menstrual cycle. Even affects your hormone, okay, because if you don't eat fats, your hormone is going to be all over the place. Okay, you will affect your mood. Okay, so you can say abnormal body functions, so many. Okay, your menstrual cycle, your hormone and everything. Okay, so what should you do? So you should get some psychological counseling. Okay, tackle the root problem first, and then what do? Eat a balanced diet. Okay, I know it sounds easier than it is, but yeah, that's the way. Okay, balanced diet. All right, so B, explain how the eating habits affect the health. Okay, taking food at irregular times, frequent empty stomach. Okay, so this is our gastritis. Taking food at irregular time cause. Where the hell is Huda? So I'm sorry, what's that? Must be some mistake here. So I can't answer for Huda because there's no Huda here. So I can only answer for Amira. Okay, 5 marks. Okay, because another 5 is for Huda. Okay, so who is Huda? Good question. So eating habits and their health. Okay, so might cause gastritis. So what is gastritis? You explain. Basically, it's the inflammation, okay, of stomach epithelial lining, okay, due to excessive gastric juice, okay, or acid. Okay, so how does it affect your health? Okay, might develop gastric ulcer, okay, or gastric cancer, okay, gastric pain, indigestion, acid reflux, so many you can write. Okay, so wow, that's it. So easy. Okay, so as you can see, most of these are most people, they love this part of the chapter because it's easy to understand and it's easy to write in exam. All right, 10 marks, you should have no problem scoring here. So that's it for this chapter and that's it for this week. Okay, I hope you learned something new today, not only for exam but for yourself. Okay, if you know how to eat right, this thing is like a life lesson for you. Okay? You know what to avoid, you know what not to eat. I'm sure all of you know. Okay, you just need a motivation to tell you to do so. Okay, so I think every human deserves to be healthy. Okay, take care of yourself. That's what you must do. Okay, you are what you eat, again, like what I said. So thank you for listening. I hope this video is helpful. I will next week we might go into chapter 10. Okay, so if you have any question, post it down below and I'll gladly answer them. All right, stay safe and I will see you next week. Bye bye.